obesity is a highly complex problem, which is a product of a whole load of different factors. So in part, there's a kind of biological predisposition, which maybe drives the way we react to food. There's an environmental factor, which provides us food out there in the world around us. And then there's also psychological factors, which are to do with our childhoods and our learning and our thoughts and our beliefs and our expectations and our emotions. And all of that together creates a complex problem where people respond to the world around them in ways that makes them then eat too much, do less exercise than they actually need for their bodies, and then gain weight. But it's very much a dynamic between those different factors.
You've written extensively about eating disorders and weight management. What is the key to reducing obesity?
Well, we need to understand why people eat. And I think people eat for kind of three basic reasons, really. One is around emotional regulation. So we use food when we're bored, when we're fed up, when we're wanting to manage our emotions. We use food for social interaction. So food is fundamental to, having dinner with somebody, to family life, to religious life, to cultural life. And we use food as part of a kind of communication process. So it says who we are. It's a statement about who we are. And then on top of that, the world provides us with food so that when we're having an emotion or when we're having a social interaction or when we want to make a statement about ourselves, we then turn to that world around us. And so trying to change what people eat or trying to change the problem of obesity is a two-pronged approach. You have to change how people think, but you also have to change the world around them. And what we've found from the last 30 years is that actually trying to change the way people think and respond to food is increasingly difficult because it's so embedded in who we are from the moment that we're born and the way we're brought up. So people need help. And the help that they need in order to change what they eat and how much exercise they do is through changing the environment around us. So we need the food industry to stop giving us high energy, high calorie, cheap food, which is always available to us. We need the government to change the structures in our world so that we can be more active, we can cycle, we can have street lighting, we can have parks, we can have facilities available to us. And then if that world around us changes, then people can make better choices for themselves, but they still need that help to make those choices. So it's a dynamic, it's always a dynamic between us as individuals and the world around us in our environment.
What about the criticism you're an apologist for the world around us, and you should be saying to people, learn a bit more self-discipline?
Well, people often call Nanny state, and they don't like it when the world around us is told to change what we do. They think that we have, the right or the freedom to make the choices about how we behave. But we're always turning to the world around us to change what we do. We have traffic lights which stop us from crashing our cars into each other. We have signposts on roundabouts which tell us which way to go. And they are just simple signalling from our environment, from our world, which are introduced through government legislation, which then help us make better choices. So I think blaming people as individuals for making those wrong choices really misses the point, because all the way in our life anyway, the world helps us to make good choices or encourage us to make bad choices. So we have to change the world. We still have to help people who are individuals make those choices, but it's just about creating an environment where those choices are easier to make in the right direction.
The World Health Organization regards childhood obesity as one of the most serious health challenges of the 21st century. That's what they call it. By normalizing obesity, aren't we in danger of adding to what the WHO say is a health crisis?
Well, there's two components, aren't there? There's people who are already overweight, people who are already living with obesity, and then which is the treatment component, and then there's a prevention component. So we need to manage both of those two things, and both of those often create a kind of tension, because the people who are already overweight, already living with obesity, have bodies which are associated with being unwell. So we need to manage them in a way that makes them feel good about themselves, encourages their self-esteem, isn't critical, isn't negative, isn't blaming, so that they can then take control and they can live well and look after themselves. At the same time, we need to look after those people who haven't become obese yet, and that's a prevention strategy, which is to do with our future generations, and enable them to understand that living well is also good, because gaining too much weight, being sedentary, eating an unhealthy diet is not going to be good for them in the future, because it will lead to health conditions. And we know clearly that there's an association between obesity and a whole range of different health conditions. But it's getting those two messages out there, which is what's so difficult. So absolutely, you do not deny that obesity is associated with all sorts of health conditions, which it clearly is. But you have to do that in ways which doesn't stigmatise those people who are currently living with obesity, but also encourages those people who haven't become obese yet to still feel that they can live well.
Professor Jane Ogden, many thanks to you for joining us on The Agenda.
You're welcome.